So advanced care planning is a process or a planning process where an individual would complete a document that states what their wishes are if they're unable to speak. Those wishes are typically medical. So if there was an emergent situation, they were no longer able to voice their needs, then this document states what those needs are. I always say when talking to my patients, we plan for marriages, we plan for babies, but we don't plan for death, and we certainly don't plan for emergent situations. It's not something that should be looked at as morbid, but certainly it's about being successful. We talk about in life, especially in this society, planning. If you don't plan, you fail, right? So what a beautiful way to honor your own life and to remain dignified when emergent situations do arise by actually planning this. So the decisions can vary. Typically, those decisions could include whether you want CPR, they can include whether you want to be on a ventilator, but they can get even more specific than that. I've had a client who was so detailed, she wanted it down to who the pastor was she wanted at her bedside. You know, she wanted aromatherapy. Those are things that she added additionally to her advanced care planning. It's kind of like you think about a birth plan, it would be kind of the reverse for that. So it's very detailed. I think that young people really should, it's something they should look at more closely. Statistics show that here in the United States, about 25,000 young people between the ages of 15 to 24 have accidental injuries all the time. And so oftentimes in those accidental injuries, their voices, they no longer can speak, but this still gives them a voice. I look at it as a gift that the patient or client gives not only themselves, but their family. When emergent situations arise, tensions run high, emotions are high, and it can be very difficult on moment's notice to be able to determine what does your loved one want. But when something has already been documented, they can just simply follow that.